Hi there, and welcome to the office today. My name is Dr. Jones. Please make yourself nice and comfortable. If at any point you need anything during today's appointment, just let me know and I'll take care of you as best as I can. If you need a glass of water or if you just need a quick break, that's absolutely fine, of course. Please don't hesitate to speak up. So, you've been sent to me today for a cranial nerve exam, is that correct? Yeah. Okay, so have you ever had a cranial nerve exam before? You have? There we go then, that's excellent. I'll skip the explanation and we'll get right into it. But of course I will explain everything that I'm going to do as I'm doing it. Okay, so obviously during today's exam I'm going to need to come quite close and personal to you, and I may even need to touch areas of your face. Is that okay for me to do? Yeah, that's great. As I said, I'll explain everything I have to do as I do it, so there'll be no surprises for you. But basically, the tests that we're doing today will be very simple, very easy to follow. I'll give you instructions, you follow them, I'll take down the results, and it'll be as simple as that. It'll probably even be a nice, relaxing experience for yourself. Okay, so we'll get started. I'll just pop on some latex gloves now just to keep things nice and hygienic, of course. Okay, so before we actually begin the cranial nerve exam itself, I just want to quickly ask you how you're feeling in general. Are you feeling any sort of general ill symptoms at the moment, like a sore throat or stuffy nose, headaches, anything like that? No? Okay, so before we begin, I do want to quickly listen to your heartbeat and your breathing, just to confirm that you don't have any minor illnesses that might affect today's results. Okay. Okay, so if you could lift your shirt for me, please. I'm just going to be placing this stethoscope directly against your chest, a few different locations. To begin with, we will just listen to your heartbeat. Okay, so I'll just place that there if that's okay. Very good. Sorry, I'm just counting your heartbeats at the moment. Okay. Okay, that seems very good. Seems like a strong, steady rhythm, which is exactly what we're looking for. Seems to be about within the average range as well, which is perfect. Okay, so I do just want to listen to your breathing as well, if that's okay with you. I'll just place it once again against your chest here, and this time if you could take in a deep breath for me, please. Very good. If you could breathe out for me now, please. Marvelous, that sounds great. I'm just going to move to a different location, and if we can repeat the same thing, please. Deep breath in. Very good, and deep breath out. Okay, there we go. Everything is sounding very good, very healthy from what I can tell. So for the first part of today's cranial nerve exam, I just want to do a very quick smell test with you. I have a few bottles here with artificial scent in them. What I'm going to do is I'm just going to hold them up to your nose. If you could take a quick sniff of them, and if you could tell me what you smell, please, that would be fantastic. Okay, so here we go. Scent number one, if you could take a smell of that for me, please. Very good. And what do you smell there? Coconut. second scent now. Just need to shake them up briefly before I present them to you, just to make sure the smell is strong. There we go. And what can you smell from that one? Vanilla. Very good. And now on to the third and final scent. Okay, let's present that for you. And again, if you could take a sniff, please. And what do you think that one smells like? Strawberries. Very good. 3 out of 3. Perfect start to the exam. So now I just want to very quickly feel around your nose, if that's okay. So do you in general feel any stuffiness or trouble breathing at all? Any congestion of the sinuses? In general, everything seems to be okay, yeah? Okay, I can't feel anything that would indicate there's a problem there, and from what you said, everything seems to be very good. Okie dokie, so we're now going to move on to the taste test portion of the cranial nerve exam today. What I'm going to be doing is I'm going to be dipping little strips of paper into artificial flavour. Again, we will have 3 flavours as we had 3 scents before, and I'm going to be placing the strip of paper on your tongue, and if you could just identify the taste for me, please, that'd be excellent. Okay, so very similar procedure. I'm just going to have to quickly shake up each bottle, make sure the flavour is strong. Okay. I just want to dip this in there. Okay, and if you could pop your tongue out for me, please. That's excellent. I'm just going to place that on your tongue. Very good. And what flavour is that? Coffee. There you go. Very good. Good start. Move on to the second scent now. We'll just place a fresh taste strip into that one. And once again, if you could pop your tongue out. Very good, thank you. And what does that one taste like? Tastes like lemon. Fantastic, very good job, thank you. And now, on to the third and final taste test. Marvelous. Here we go, ready for the last one. There we go. And what do you think that one tastes like? Raspberry. There we go. Very good. 3 out of 3 on the taste test as well. Very good performance so far. Everything looking good. Okay, so now I'm going to start looking at your vision and your eyes, your optic nerves, how they are behaving. To begin with, I would just like to do a very quick and very basic eye test with a standard eye chart. So if you could please make sure that you're stood just about where you are now. Please don't lean forwards or anything like that. I'm going to hold the chart here. This distance from you is perfect. And first of all, I would just like you to do a general reading. Can you read this letter here for me, please? Very good. And this letter here. Good. This letter here. Good. This letter here. Good. This letter. This letter. This letter. This letter. This letter. This one. those. So now what I'd like you to do, please, is if you could cover one of your eyes for me. That's excellent. I'm going to point to random letters and ask you to read them out with just the one eye this time. Okay, so this letter here. Good, this one. 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 Good. Any letter on this line? Okay, there we go, very good. And now if you could switch to cover the other eye for me, please. Perfect. And now this letter, please. Good, this letter. 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 Okay, any letters here at all? Okay, no problem. You can uncover your eyes now. That's good enough performance. At least 20/20 vision, so very good there. And just very quickly, can you identify this colour here for me, please? Good. And this colour here for me, please. Very good. Thank you. Okay, so what I'd like you to do now is to focus your eyes on my nose, please. And I'm going to wiggle my fingers, perhaps one, perhaps the other, perhaps both, various locations within your field of vision. And I would just like you to tell me, please, left, right, or both, whichever finger I'm wiggling. Okay, so we'll begin that test now. Very good. 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 Excellent job. Now I'm just going to be marking the edges of your peripheral vision, so to speak. So what I'd like you to do is again to focus on my nose. I'm going to hold my fingers together and I'm going to move them in various directions like this. And when they leave your field of vision, I'd just like you to tell me. Okay, so I'll begin that test now. Here we go. Very good. 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 That's excellent. And for this next part, I'm going to flash up the number of fingers, and I just want you to quickly repeat back to me, or tell me rather, the number of fingers that I'm holding up. Okay, so here we go. Good. 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 Very good. 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 There we go. Excellent job. Very good. For the next part of the cranial nerve exam, I'm going to be needing to take you into the dark room over there. It's just literally a darker room than this one. I'm going to be shining a light into your eyes, observing how your eyes react, and we'll be doing a few tests involving light and darkness. Okay, so if you'd like to just take a step through to that room for me, please. Thank you. Okay, and welcome to the dark room. It's nothing special, I'm afraid. It is literally just a very dark room. So we're going to begin looking at your eyes now. I'm going to be using a torch. I'm going to be flashing this light into your eyes. You may find it a bit intense. If you need to blink, please do so, of course. But I am going to be trying to observe your eyes, so obviously please don't blink too excessively. But no worries. First of all, I just need to do a very general examination of your eyes. Okay, so just look straight ahead for this portion. That's absolutely fine. You don't need to do anything special at this moment in time. I am just observing how your eyes are responding and behaving in this light now. eyes, but only moving your eyes, not moving your head. So keep your head nice and still, and then follow the light with just your eyes. Exactly, just like that. Very good. Okay. Marvelous. And how do you feel whilst doing this? You aren't experiencing any sort of eye strain, any discomfort or pain? No, nice and easy. There we go. Very good. That's what we like to hear. I'm just going to be increasing the speed a little bit. Any problems or unusual feelings with the increased speed? No, all okay. There we go then. Looking good. And now for this part, I want to place my hand along your nose, and this is to separate your eyes, so to speak. I'm just going to be flashing a light into the one eye, and I'm going to be observing how the pupils respond when only one eye is exposed to light stimulus. Okay, very good so far. I'm going to switch that over to the other eye. Okay. Okay, very good, very good. Okay, and now finally I'm going to be looking at your focus. Okay, so I'm going to hold my fingers here in the background, I'm going to hold the light quite close to you here, and I'm going to ask you to switch your focus from my fingers in the back to the light in the front. Okay, so if you could start focusing on my fingers, please. Good, and if you could switch focus to the light. Good, switch focus. Switch. 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 Okay, that's good. And now we're just going to be doing almost the opposite arrangement. Fingers will be very close to you, light afar in the background. So again, if you could start your focus on my fingers, please. If you could switch focus. Switch. 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 Okay, there we go. Very happy with the results of your eyes and how they're behaving with light stimulus. Okay, so if you'd like to step back into the other room now, we can carry on with the rest of the cranial nerve exam. Okay, do you need a quick break before we continue the cranial nerve exam today, or are you okay to continue? Okay to continue. Shouldn't be too much longer left actually, but next I would like to test your senses around your face and how you can feel things. Okay, so for this section I'm going to be using this cotton bud, slightly different design to usual. We have a very soft blunt end on this side, and then we have a sharper end on this side. I'm going to be touching you in various locations of your face, and I'd just like you to tell me sharp or soft, whichever you can feel. So obviously for this I'm going to need you to close your eyes for me, please. Okay, and now I'll just begin touching your face. Sharp or soft? Yeah, very good. 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 eyes now. Each one identified perfectly. Thank you very much. Good job. Okay, so at this point now, I want to test some of your muscles, how they move, their strength, how they work, see if everything is okay, if there are any problems that might need to be addressed. Okay, so to begin with, I need you to make a few slightly silly facial expressions. If you could follow along with me, please. To begin with, I need you to puff your cheeks out for me, please. Very good. I need you to bare your teeth for me, please. Very good. I need you to frown for me, please. Very good. I need you to raise your eyebrows for me, please. Very good. So now I'm going to place my hand lightly against the side of your face, and what I want you to do is to move against my hand. I'm going to be applying a little bit of pressure and force to try and stop you. Okay, yeah. Use as much strength as you can, yeah. There you go, very good. And now the exact same thing, except in the opposite direction. Very good, very good. Placing both my hands on your cheeks now. If you could once again puff out your cheeks for me, please. Very good. Now I'm going to be placing my hand on the underside of your jaw, and if you could try and open your mouth, please. Very good, very good. Okay, now I'm going to be placing my hands on top of your shoulders, and if you could shrug up against them for me, please. Very good. If you could hold both your arms out now at arm's length, just like this, just like that. Perfect. I'm going to be holding either side of your hands on the outside here, and if you could push against my hands, just like that. There you go. Very good. And now I'm doing the same, but on the inside, if you could push inside. Very good. And if you could bring your arms up, push them up against my hands. Very good. And push downwards against my hands. There you go. Very good. All muscles looking as strong as they should be. Very good. Okay, so now I'm moving on to the hearing test portion of the cranial nerve exam. So to begin with, I just want to look inside both of your ears with an otoscope. This is just to allow me to see a bit more clearly if you have any buildup of wax, any inflammation, any signs of infection or anything out of the ordinary like that. Okay, so I'm just going to be coming in now and checking out this ear here. So it shouldn't be painful when I'm placing this into your ear. Do let me know if it is uncomfortable though, of course. Okay, can't see any bad signs there. And we'll move on to the other ear for you now, okay? Okay, everything looking very good. No excessive earwax buildup. No redness, no signs of infection. Good start. Okay, so now we're going to be doing a very basic rudimentary hearing test. For this, if you could close your eyes, please. I'm just going to wiggle my fingers next to one or both of your ears, and I would just like you to tell me, please, left, right, or both, depending on which ear you hear the sound in. Okay, so we'll begin doing that now. Yeah, that's good. Yeah, that's good. Very good. Okay, I'm going to do it a little bit more rapid fire now. Very good. Very good. 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 Very good. Very good. Okay, you can open your eyes now. For this next part, I'm going to be doing almost the same thing, but I would like you to tell me when you can no longer hear the sounds of my fingers wiggling. I'm going to be basically moving them further and further away from your ears. And yeah, if you can tell me when you can no longer hear it, please. Okay, here we go. Very good, once more. Good stuff, and just the one ear now. Very good, the other ear. There we go, looking good. And now I'm just going to be softly whispering a word or a number in either of your ears, and I would like you to repeat back to me the number or word that I say, please. Okay, so we'll begin that now. 21. Good. 34. Good. Banana. Good. Watermelon. Good. 7. Good. 6. Good, very good. Okay, that actually concludes today's cranial nerve exam. Thank you very much for following all the instructions perfectly. No trouble, I think, understanding each other. All okay. Do you have any questions for me about the procedure today? Okay. Yeah, well, what I'm going to be doing next is I'm going to be collating your results into a short report. I'll send that back to the doctor you saw previously. They will review it and they will contact you for a follow-up review appointment. They will do this even if it's just a general quick conversation with you, just to discuss the results, even if they're positive. So no need to worry when they do contact you. It's, could be positive, could be negative, but from what I've seen today, you've performed excellently well. I don't think there are any areas for concern whatsoever from what I can see, but obviously I need to go away, take a closer look at the results just to make absolutely certain, and then they'll be passed back